Hi, I'm Courtney Fitzpatrick.
I'm Alex Clendenning.
And we are doing a presentation on exercise in the pulmonary system. The function of the pulmonary system is getting rid of waste products while distributing oxygen throughout the body.
It pumps blood through the right side of the heart, through pulmonary vessels, to the lungs, and back to the left side of the heart. This circulation conveys blood to the lungs via the pulmonary arteries to reduce carbon dioxide levels and increase oxygen levels, before returning to the heart via the pulmonary vessels. Pulmonary gas exchange, or gas exchange of carbon dioxide and oxygen in the lungs, are one of the strongest links in the gas transport chain during exercise.
This being said, exercise can strengthen and make the pulmonary system more efficient.
There are many benefits of the pulmonary system via long-term exercise. As far as the lungs, exercise can strengthen the muscles that expand your lungs, increasing the amount of air you're able to take in. With long-term exercise, you're able to form more capillaries around the air sacs in your lungs, enabling you to absorb oxygen in the blood quicker. This, in the long run, will allow you to exercise for prolonged periods of time at a higher intensity.
Regular exercise for a prolonged period of time will result in your heart muscle becoming stronger. The strengthening of your heart results in you being able to pump more blood with each contraction of the heart muscle, providing more fuel for your muscles. This increased heart function means that your resulting heart rate will slow down faster because more blood is being pumped with each contraction.
Red blood cell production. With exercise, you increase your number of blood cells flowing through your circulatory system. Red blood cell oxygen are transporters throughout the bloodstream. Exercise will increase the efficiency of red blood cell delivery system of fuel to the muscles. An efficient red blood cell transport system will result in being able to perform at a higher intensity of exercise for a prolonged period of time without your muscles feeling fatigued.
With exercise, you increase the efficiency of the pulmonary system's general functions, to excrete waste products such as carbon dioxide, and to better the lung, blood, and heart function. This, in the long run, makes for a better performance and a better you.
In summary, with long-term exercise, the pulmonary system gets rid of waste faster and pumps oxygen into your blood at an efficient pace, giving your muscles more endurance to resist fatigue during high-intensity workouts.
Diseases within the pulmonary system include bronchitis, emphysema, and pulmonary fibrosis. Bronchitis and emphysema are pulmonary diseases that contribute to chronic obstructive pulmonary disorder, which affects an observed 14 million new patients per year in the United States.
Bronchitis is categorized by the inflammation of the bronchioles within the lung. The mucous membrane will become inflamed and the air passage will be further narrowed by mucus in the center of the bronchiole, restricting the flow of oxygen to and from the air sacs, slowing the gas exchange of carbon dioxide and oxygen, and leaving the individual with shortness of breath, dizziness, coughing and wheezing, and makes the pulmonary system less effective during daily activities as well as exercise. Acute or short onset bronchitis is generally viral and can accompany an upper respiratory infection and lasting sometimes up to 6 weeks. Chronic bronchitis can last for up to 3 months or longer depending on the case.
Emphysema, unlike bronchitis, affects the air sacs within the lungs rather than the bronchioles. Emphysema is a chronic disease that occurs after an irritant such as cigarette smoke or certain toxins in workplaces have been exposed to the lungs for a long period of time. In emphysema, the air sacs over time will begin to expand and thicken, becoming brittle, and sometimes they can even rupture. This will hinder the gas exchange process in the pulmonary system and will usually require an oxygen resource to supplement regular breathing.
Pulmonary fibrosis is a condition in the pulmonary system that is defined by scar tissue around and in between the alveolar sacs and the lungs. The scar tissue becomes callous and creates a thick barrier that disrupts the exchange of carbon dioxide and oxygen, leaving the patient with shortness of breath, labored breathing, and several other symptoms of an inefficient pulmonary system. Scar tissue in the pulmonary fibrosis can be brought on by a variety of different factors, including hazardous materials in the workplace, silicone dust, some heart or chemotherapy medications, radiation therapy, and past illnesses such as pneumonia, tuberculosis, and lupus.
With any of these diseases within the pulmonary system, it will be very difficult for the patient to undergo regular exercise as there is a significant reduction in oxygen from the lungs to the bloodstream and from the bloodstream into the lungs to be expired. As the heart pumps faster to provide more blood to the muscles and eliminate waste gases the lungs will not supply, it will not be able to compensate and early fatigue will occur. This is a low-budget film brought to you by Alex and Courtney. Art done by Courtney Fitzpatrick and production done by Alex Clendenning.